bakody
Why do you have your hand on
sign.
their head? And they say it relieves the pain, tingling, numbness that's going into their hand. So if they have pain, tingling, numbness into their hand in a dermatomal pattern, and it's relieved by putting their hand on their head, that is your positive for bakody sign. And it would suggest radiculopathy. So radiculopathy from adhesions, space-occupying lesion, from IVF stenosis, anything like that, that's your positive for bakody sign. If they're doing it to relieve any local pain, that would be a false positive. Next week we'll talk more about what false positive means. And that would be something local to the area, like a neck injury, shoulder injury, something of that sort. And so that's bakody sign, relieving radiculopathy. Rest sign is a really important one to look for, and that's something that if someone comes in after a trauma of some sort and they're holding their head up, cradling their neck like a cervical collar, that's a sign that you want to pay attention to, because that means that they may have fractured their neck, they may have dislocated their neck, or they have a very severe sprain strain. So they have cervical instability, they feel like they can't hold the weight of their head up without their hands. So you definitely want to think what, if you see rest sign about hip urinal, moving your x-ray earlier. Yeah, so you definitely want to move x-ray earlier because you're suspecting possible fracture, possible dislocation of the neck. So you really want to rule out any severe injury like that before you start moving them around, certainly before you try to adjust them. So those are two signs to be aware of, rest sign and bakody sign. Bakodys you can actually turn into a maneuver also if you do suspect radiculopathy. You could teach them that and see if that helps to relieve their symptoms while they're healing from whatever is causing that radiculopathy. That can be beneficial. Okay, and then let's do cervical compression and Jackson's, which is a part of cervical compression. So who would like to be our patient for cervical compression? Volunteer. Have a seat here. So cervical compression, you're going to stand behind your patient. And actually, I'm going to have you swing around toward the class. This way. There we go. And so we're going to do 7 ranges of motion with compression straight down. So with cervical compression, start off with them in neutral, and you're going to press straight down, then also do flexion and extension. And they don't have to be in full flexion extension, they just have to be at least partially flexed and extended. So your head, and then lateral bend, and press down, lateral bend, press down, rotate, and press, and rotate, and press. And finding out if there's any pain, tingling, numbness, any kind of discomfort with this. If they do have pain and it's in a dermatomal pattern, that would be suspicious for radiculopathy. You're thinking either disc herniation, IVF stenosis, maybe a tumor causing radiculopathy. If they have local pain, local or diffuse pain in the neck, then you're thinking things that are local. So subluxation, you're thinking sprain strain, possibly anomalies of the neck like BJV, Facet syndrome would cause that deep, achy, diffuse type of symptoms. So that's what you're thinking if they get more of a local or just diffuse referral pattern from the neck with cervical compression. And then Jackson's test is one part of cervical compression. So if you see just Jackson's on its own, all they're doing is the lateral bending and compression. So it's the same findings, but just with just the lateral bending part. So if you're doing cervical compression, you do all 7 ranges of motion starting with neutral. If it's Jackson's, just the lateral bending part.
Why they would not believe it?
Sometimes just for efficiency, that one seems to be commonly positive if it's a disc herniation, so they might just want to quickly say, do I think it's a disc or do I not?
If it is something like disc herniation, is it going to present right away when you, or are you holding it all for a certain?
You don't need to hold really, so it will present as you press down typically. You'll say, oh, that's hurting into that pattern. Question. Other questions about cervical compression, Jackson's test? All right, so go ahead and do